Hi, everyone, and welcome to the Foster Files. My name is Kelly, and I'm a foster with Cross Your Paws Rescue in the Pittsburgh area of Pennsylvania. And I have a guest with us today that I'm really excited to talk to, and every time I see this person, I'm always learning a little something new from them. So today I am talking to Dr. Hougentogler. He is with KVET in Greensburg, Pennsylvania. And the reason that I'm speaking with him today is because he practices some alternative forms of veterinary medicine that I think would be so interesting for us to discuss and to learn a little bit more about as we journey through our developing some tools for our pets' well-being. So, hi, Doctor. Can I call you Dr. H? I feel like that's going to be a little easier for me.
That's fine. You can call me
Awesome.
Dr. H. That's whatever you like is fine.
All right. Well, thank you so much, Dr. H, for joining us. How's it going today?
It's going pretty good. How about yourself, Kelly?
I'm doing well. Thank you. So, I'd like to start out learning a little bit more about you. Tell me about your journey into veterinary medicine. Where did you go to school and how long have you been practicing?
Well, I've known for some time that I wanted to become a veterinarian. It really goes all the way back to middle school for me as to kind of when I had the first idea of that. And so everything through middle school, high school, undergraduate was always geared towards getting into veterinary school. I went to undergraduate at St. Vincent College in Latrobe, Pennsylvania, nearby, and then went my first year of veterinary school is actually in St. George's in the West Indies in the Caribbean. So it's the first year that they were open, and since I didn't get in anywhere in the United States for the first year, because of course it is very competitive, I did my first year there, but was able to transfer into the University of Illinois, where I graduated in 2003. Ever since then, I've been practicing in Western Pennsylvania. Did 2 years at an emergency clinic, and then 11 years in a small two-doctor practice near Murraysville, and then for the last, I guess about 8 years now, I've been at KVET, which is kind of a middle-sized practice, but focusing on, as you mentioned, just general medicine, but also alternative medicine.
I'll tell you, going to the West Indies for your first year is not such a bad alternative. I'm sure you didn't mind
Mhm.
it.
There were things that were very nice. It
Yeah.
was a little intimidating because that was the first time I'd actually ever been on an airplane, was to fly
Oh,
to there.
wow.
So it
Wow.
was, for me, that was a little bit intimidating on a lot of different ways. And everything happened so fast because it was a new school. So like from the time I applied, did an interview and got accepted and was there was probably all within the summer leading up to that. So it's not like I had like a many months to like really plan this and think about it. It really all happened very quickly.
Yeah, that's a massive adjustment. Luckily,
Mhm.
you knew what path you wanted to be on, so it was probably
Mhm.
a little easier to swallow such like a hard and fast adjustment. So, yeah. Well, I want to talk about some of the alternative medicines that you practice. So,
Mhm.
just to kind of let everybody know, I have mentioned on this podcast before that our Shih Tzu mix Snowball has degenerative disc disease. And so when we figured that out with our regular vet, we were guided toward spinal manipulation. And
Mhm.
I was aware of KVET because I actually knew someone that used to practice at KVET. She's no
Mhm.
longer in the state.
Mhm.
And I reached out and said, let's give this a try and let's see if this is something that'll be really helpful. And I think I've been coming to you with Snowball for about 2 years now. I want to say it was 2 summers ago.
That sounds about right.
So tell me a little bit about how you got into alternative medicine and why you believe in it. What are some of the other methods that you practice?
Yeah, so probably my first real interest didn't come until probably about 10 years after graduation. That in one of our CE meetings I was attending, they were having lectures on alternative medicine. And for something different, I decided to go attend. Just found that some of the things really clicked, specifically with the traditional Chinese medicine that the lecturer was talking about. Just really clicked with me. And so I thought, well, let me look more into this. And at the time, there's really two big programs, and there may be some more that are, a little bit smaller, but the two big ones are Chi University in Florida and International Veterinary Acupuncture Society, or IVAS. Those are the two big organizations that do a big acupuncture course. You can get certified in veterinary acupuncture. And so the Chi Institute, now called Chi University, but when I went there, the Chi Institute was the one that interested me the most. And at the time, I was working for a boss who did not have the highest regard for alternative medicine. So it was a hard sell to do a 6-month course that was going to be, be a lot of money CE wise to take all the modules and everything in order to get certified over that 6-month time. And so I started looking for other alternative sources because that kind of piqued my interest of, well, maybe there's other things out there I can do. And that's when I found the spinal manipulation technique that I use, called veterinary orthopedic manipulation. I found it. I saw that they do several weekend seminars a year all over the country, and one was happening close by. And I thought maybe this could be kind of my foot in the door on alternative medicine in my current practice. And so I took the course, started using that first in practice at my old practice, and saw some very good results. Results of, patients like Snowball who kind of have the gradual decline, but also those who would present very acute, with their presentation, and very severe, sometimes even presenting paralyzed. And we're able to make some progress with those patients without them needing to go see specialists or have surgery, which in some cases, that's usually what's recommended to give them the best chance. And when that's not an option for an owner, then, we like to have other things that we can do on top of the medical stuff that we typically would do in that situation. So I started with that, eventually did, impress my boss enough that he did eventually allow me to go take the acupuncture course. And then that's what led me to KVET, and it's just expanded from there. Started doing rehab about 3, 4, maybe 5 years ago. I will say 4 years ago, I started taking the rehab certification class, which I'm still kind of working on, but it's kind of hit a bit of a stalling point because it's so busy at KVET. It's hard to kind of progress with something like that as intense and as in-depth as the rehab, canine rehab course.
So what are some of the unique benefits that you see with some of these alternative medicines? Why do you stand behind it the way that you do?
Probably one of the biggest benefits over kind of conventional medicine is lack of side effects. It's probably the biggest benefit because, especially when we talk about chronic problems, we're looking at medicating those patients for a long time. And even if the side effects are mild, it's going to add up over time. So if there's a way that we can minimize our reliance on those medications and their side effects, I think that's always a positive. It also gives us a different tool, so to speak, if something's not working. If if something's not an option, like again, for a patient that has, severe enough disc disease that they either can't walk or they're so weak or they're incontinent, if surgery is not an option and medications are not working like they used to, we can add other things in to try to help with those symptoms. So it's just another tool on the, as we like to say, in our tool belt or our toolbox that we can reach for when something's not working as well as we would like it to.
What is the benefit of acupuncture specifically? Because obviously acupuncture, there's an argument to be, not an argument, it's a fact. It's been around for thousands of years. I actually tried it myself on some back pain that I had probably 4 or 5 years ago. I didn't necessarily find that for me, it was something that moved the needle in the direction that I wanted to go. So when do you use acupuncture as a tool? Like, what are some examples and what are some of the benefits that you see from acupuncture specifically?
Yeah. So the nice thing about acupuncture is it's a complete form of medicine. Some of the things that we do that are alternative are very specific for certain things, like the spinal manipulation is for mostly back problems or neurologic problems. but it's probably not going to do very much for a dog that has chronic gastrointestinal problems. Same thing even with rehab. That's going to help with mobility issues, but it's not going to help a dog that has heart disease or maybe a cat with asthma. Acupuncture can address all of that and more. It's a complete form of medicine. You can address the chronic pains and the things that are causing mobility issues. You can also treat GI issues. You can also help treat heart issues, kidney disease, liver problems, again, respiratory. It's behavioral, anxiety. These are all things that can be addressed with acupuncture. So it's not just limited to those chronic problems that lead to mobility issues in an older patient. They can be used for anything to help treat or to mitigate. And that's probably the biggest benefit. And again, the side effects, acupuncture is pretty much side effect free, at least as far as on internal organs. Combine that with herbal medicine, and you've got a pretty powerful 1-2 punch that you can use on just about anything. The herbs are going to have more side effects, but again, a lot of the ones that we use are milder and for more chronic problems. The ones that have the most side effects tend to be the ones for more acute problems. And again, depending on the severity of the acute problem, you may consider that still a win if it's for a severe problem that needs to be treated and treated quickly.
Are vets who are in practices that don't have alternative medicines, are you seeing them refer for alternative medicines? Is there business coming your way, kind of like how I came your way frequently, or is there resistance to this in your field?
It really cuts both ways. I'd probably say the most accepted of the alternative treatments that we do is going to be the rehab. I think there's a lot of veterinarians out there, even the specialists, who would recommend rehab for a patient that was having issues that they felt that it could be helped, or that they feel like that there's nothing more that they can do for them. If we're talking about, say, like a surgeon, they don't think that there's anything that they could do that would be worthwhile to help a patient. They might recommend them for something like rehab. Acupuncture is really looked at by some to be a benign thing that doesn't work. So as a result, they'll say something like, you can go do that if you want, but it's probably not going to work.
Let's be fair, doctors are saying that too. So they're certainly not restricted to animal medicine at all.
Yeah. And, the one that definitely gets the most animosity from within the profession is the spinal adjusting. That is something that most will actually actively discourage owners from going to get. My concern is that if you're going to get it, you just want to make sure it's somebody who's trained to adjust animals. I've heard lots of stories of owners taking their pets to their own chiropractor who's not trained in adjusting animals or trained in adjusting humans. And yeah, there are some similarities in the anatomy and the physiology, but it's still not the same. And so they need to be trained in how to adjust them. The other thing is that they can get into a lot of trouble for that too. So you do want to avoid that, especially if you like your chiropractor, because I've had more than one person telling me that their chiropractor went out of business because they were getting all kind of penalties and fines from local state boards because they were adjusting animals while they were not trained. And some of the boards look at that as practicing veterinary medicine without a license. So you do need to make sure that you get trained properly so that, you can do it without having to worry about that. That being said, some still do come after them. But if you have that training and all the things you need to make sure you're doing it appropriately, ideally with a veterinarian, like in a veterinary hospital with a veterinarian in the building is going to be your safest bet for that. But because of that, that's the alternative modality that probably gets the most discouragement from within the profession by far.
That was actually the advice that I had been given when I talked to my vet back when we realized, that this was degenerative disc disease, that we knew it was going to progress over time. There wasn't really a cure for it. Plus, at the time he was 13, how much are we really going to be capable of doing? And I don't remember if they brought up adjusting or if I did. But either way, the agreement was make sure that you find an actual vet that does it. And like I said, fortunately, I was aware of K-Vet just generally. So I was able to really very easily make that connection. But it is good for people to know that if they are looking for these alternative types of medicine, that they're attaching it to someone who is a vet. What's the acronym? DVM? DVM?
Well, there's DVM and VMD. They
Okay.
both are the same thing. One I think is just Latin, and the other's not. But
well, nobody speaks Latin. We won't use that.
Yeah, I mean, chiropractors can adjust animals. They just have to be properly trained. And they have to have a veterinarian examine the patient and say, yes, I think you should get them, you can get them adjusted and it would be a helpful thing for them. The safest way to do that is to go to a veterinary clinic and do that. So you can have a chiropractor, and that's who was at K-Vet when I first started there. I actually had to pause the adjustment technique I did because there was a human chiropractor who, again, was trained, and actually he teaches animal adjusting at a facility. So he's well versed in that, and he was there doing the adjustments on the pets, but he was a trained human chiropractor who learned through the right channels to adjust animals and did it under the supervision of a veterinarian. That's one of those things that can be a little fluid into exactly what does it mean to be under the supervision of a veterinarian. Although most will say if you're doing it with a veterinarian in the building, that is probably the safest way to go. So going to a veterinary hospital where a veterinarian is there, at a human chiropractor who has the appropriate training is able to do adjustments on animals. But again, they have to have the right training and be under that appropriate supervision.
What I have seen that has just really kept me coming back and back and back, and we've actually recently shortened our visits where now we go to Dr. H with Snowball every 2 weeks, is that, I mean, on Sunday, he went on a mile-long walk with us. I mean, he is 15, his back end slips, his weak in his back end, but he could do that mile-long walk, and I don't know that if we had not explored another option, I don't know that would still be the case. We might be seeing paralysis much sooner. And what I really liked about talking to you specifically was that you never said this was going to cure him. That was never on the table. That was never even brought up. It was like, listen, what we're going to try to do is we're going to try to slow down the progression of how bad it is eventually likely to get, right? So we know that there's a very real possibility that paralysis is going to be on the table at some point. And that was what I appreciated about the communication that we had. It was just about kind of making him feel as best as possible for as long as possible and seeing if this was going to be an option to do that.
Yeah. Yeah. I mean, nobody wins if there's false hope or if that doesn't help me. It doesn't help you. It doesn't help Snowball to say, oh yeah, sure. We'll get him walking in no time. And then, he's, only gradually, slowly getting better. Like you said, that doesn't help. The reality is that when we have an older patient, the benefits tend to come on slowly, if at all. And we're probably going to hit a plateau. And that plateau is not going to be 100%. It's going to be something less than that. We don't know what that is until we try and we treat and we see what the progression is. But to assume we're going to get back to 100% function, is not to be expected, except for maybe in the most extreme cases with a very young animal. That might be a situation where, hey, if we're lucky, we might be able to get them close to or at, where they were pre-injury. But when we have a patient like, again, 15 years old, to think that we're going to make them 2 again or even 5 again is just not realistic. And then that's going to get everybody down about it when we should be happy that, again, we're happy that Snowball can go for a mile walk at 15.
Right.
Just be able to get around better and maybe not fall as much and overall just have a better quality of life. And, that's really all what it comes down to. And that can look a little bit different for everybody. I treat patients who, do athletic or service stuff. And so they have to be at a high level, and, we have to get them to that level. And so, I'll get the agility dog owner who brings their dog in because they noticed that they were off by 0.005 seconds on their last run. And after they're adjusted, like, oh, yep, no, their time's back again. So, something was off.
Wow.
And then you have those who, can we just get them to walk around the house better, go outside to go to the bathroom on their own without us having to carry them and help them, and just do these we don't have to bring their food to them. They can now go over to their food dish. So that might be all we need for that pet to have a better quality of life than just kind of laying around, or they can't go over to the dish without being in a lot of pain or discomfort.
So I think talking a lot about kind of setting up, realistic standards and having, making a mistake a false hope. I think that really leads us into one of my questions, which is, what are some of the biggest mistakes that you would say pet owners make when it comes to their pet's health? And how would you suggest that people avoid those mistakes?
Well, when it comes specifically to alternative therapies, probably the biggest mistake is waiting too long. A lot of pets come in where their last stop. They've been everywhere. They've seen everybody else. Now they're coming to us. And unfortunately, sometimes it's because that's when they find us. It's that they're not looking for that before, and again, part of it may be because of, the veterinarian that they're going to is not familiar that, oh, hey, there is an alternative place nearby that we can send you. Or again, maybe they don't feel strongly about it, so they don't even bring it up. But sometimes when we have a pet that has gone through several different types of treatments or seen different specialists and gotten lots of other opinions, by the time they come to us, everything is so far that it's hard for us to see good results from that, or at least see the results that we could have gotten if we were earlier in that chain. As soon as you get a bad diagnosis of something, as soon as you get the kidney failure or the cancer diagnosis or something like that, even if they're not sick, that's the best time to come and see us and start getting some acupuncture, maybe get on some herbs. You start to see the first signs that they're having trouble getting up or getting around. You don't want to wait until they can barely move to bring them in. You bring them in when you see the first sign of them slowing down. That's when we're most able to help them. That's when we're able to, slow down that progression, but also try to make some improvements and, try to, again, it's all about making better the quality of life. And that in turn usually leads to an extension of time, with their pet, when we can improve the quality of life, because that's usually the reason that we're, just having discussions about euthanasia with patients and their owners, is that it's the loss of quality of life. And we can help that. We can help keep the quality they have, even if they're not sick, but they have a diagnosis that we know is going to lead to problems.
Can't imagine how difficult it is to have those conversations. And you've been practicing for, 20 years. How do you navigate that with people? I don't know, how do you approach that? That's so difficult.
Well, I always bring it down to the basic, basic reason we're all there, and that's to help the patient. Whatever may have happened in the past, I try to get by that as quickly as possible. And I try to say, where are we now? What can we do going forward? If you've done certain things, okay, we know these things don't work. Let's talk about what things we're going to do to try to make things work or to try to make things better. If we have some things that we know have worked, but, we're afraid to use them either because of side effects or something else, then again, we focus on that, start there and move on to new things to try to complement it, so we don't have to use those, the harsh side effect medications or whatever. We don't have to use those as often or as rely on them as heavily. And again, it's all about, the realistic expectations of where we are, where we've been, and, where can we expect to go? And that's going to be different for everyone. And And I really try to focus on, trying to help the patients, going forward and not worry so much about what has happened before, how you came to be under my care at this moment. It's just about the here and now and, going forward.
So obviously this podcast is about animal rescue primarily, right? We that's foster files, we talk about adoption, we talk about rescue. So I wanted to ask you about one of the kind of the rumors I've always sort of heard and embedded some of my philosophy in. And I have heard for years and years and years that mutts are healthier than bred dogs, right?
Mhm.
They live longer, they tend to have less health issues. And I think just sort of generally, if people are in animal welfare, animal care, and animal rescue, we do know about some of the breeds that have some of the larger manufactured issue from being designer bred. Frenchies is the first one that I can think of because they have the short snouts and they can't breathe as effectively. That's kind of the first one that comes to mind. But
Mhm.
you're nodding your head like pretty aggressively into the
Yeah.
yes. So you must see some of those differences. What can you tell me about differences in health that you see between maybe a responsibly bred, a backyard bred, or a rescued
Mhm.
animal?
Yeah, and I would even expand what you said in regards to the Frenchie, that anything that ends in bulldog is usually going to have a lot of problems bred into it. But
Mhm.
the reason that purebreds really do tend to have more health problems is because for all of the features of a purebred that were bred in there for something desirable, whether it's a physical feature, whether it's sometimes it's a drive, that is bred into them. There is usually a flip side to that is usually not good. And you mentioned the bulldogs or the Frenchies, and you mentioned, oh, they got this cute smushed faces, but
Right.
they
If they
also
can't breathe.
come yes, they also come with several impediments to breathing, which is very important.
Right.
Another one is the dachshund. Short legs,
Hmm.
long body, but they all have, since we're, talking a lot about like degenerative back problems, they all have it. And they're, all of those guys are at risk for not just having chronic back issues, but dachshunds. I've seen many who owners wake up one day or come home one day and find their 3, 4 year old dachshund dragging their back legs, just completely paralyzed in the back legs. And so that's because of that short-legged, long-bodied style that was bred in for a purpose, but it came with that cost that was not
Mm.
thought of at the time. So that's one of the things we deal with as far as purebred versus a mixed or a mutt. If that there's more of a mixing of different genes, so we're less likely to concentrate some of those bad things that go along with, again, the desirable traits that sometimes we're looking for in a particular breed. In regards to backyard breeders versus a reputable breeder, you know, I think probably the difference. This was explained to me by one of my coworkers, actually, just not too long ago, in a discussion about that. The reputable breeders are breeding for the betterment of the breed, which means no matter how much they may love a certain individual in the breed, if there's something off about the conformation, if there's something about the behavior that's not right, if there's something that you would look at as, if we kept this trait going, it's going to be a bit of a detriment to the breed, as much as that individual may be beloved. If the gait's a little bit off, or, like the conformation's not right, or again, if the behavior isn't exactly what you would like it to be, they're more likely to say, I'm going to put this one aside and not breed it, versus like a backyard breeder's just, that's
They're
not
just churning
first.
out dogs for cash.
Right. That's not what's first and foremost in their mind. And so as a result, they're not going to look that closely at things like that. They're going to say, I got a female of the right age, I got a male of the right age. Let's go ahead and put them together, and,
Right.
and let's make some puppies. The reputable breeder is going to have that desire to, really, kind of do their best to not propagate any imperfections, quite frankly, that they see in any of their individuals. And again, it doesn't mean they might not love those dogs, to death, but they just recognize that, there's something off here, and that's not something that we want to keep going. We'd like to try to weed that out if we can.
Yeah. Do you have a favorite breed?
I grew up with Labradors, so that's
Ah,
that's
classic.
definitely, yeah. That my when I go home to visit my parents, they always have a lab, and that's what I grew up with. So whenever I have a day where maybe I see like two or three labs in a day, that's always a good day for me.
Yeah. Labs are special. They
Mm-hmm.
really are. I mean, all dog. I love truly all dogs, but labs. My childhood dog was a lab mutt mix, and she was the one.
Mm-hmm.
She was a
Yep.
great dog. Yeah, they're great family dogs too.
Yeah, absolutely.
So, if someone is considering bringing a new pet into their home, cat,
Mhm.
dog, otherwise, and maybe they're a first time pet owner as an adult, or maybe they've had pets before and they're adding
Mhm.
to their home, what is some advice that you would give them to make that experience as successful as possible?
I think a couple of things that I would consider. First of all, if you are bringing a pet into a home that has pets already, you want to try to do it very gradually. It's very possible you could throw them together and they'll get along great from the start. But when introducing a new pet, even if it's a pet that maybe your current pet has gotten along with outside of the house, bringing them into the house and staying permanently is a whole different scenario. Now they're coming into this new animals coming into their territory. So you definitely want to try to introduce things slowly as much as possible, which usually kind of stages are like bringing something in with the new dogs or new pets scent. Um, Allow them to see each other, but not actually interact. When there does come time for the interaction, make sure it's supervised. I'm a big fan of the face to butt introduction first rather than the face to face. And then, just kind of do that slowly and only really progress to the next step when you feel like that both sides are happy. And if at any point there just seems to be an impasse, then you have to have a way to either manage that or you need to find an alternate placement for the new one because it's probably not going to work with your current pet. As far as bringing a pet into a home that doesn't have a pet, you don't have to worry about that. It's mainly about prepping the house that is not used to having a pet, prep it for a pet. That means if you're bringing a dog in, especially if it's young, you got to make sure that you don't have stuff lying around that they can chew or potentially consume. Because especially if they're young, there's a good chance that they're going to do something like that. They're going to find something, they're going to chew on it, or they're going to try to eat something again. Maybe it's me because I grew up with labs. That's definitely had a couple of those scenarios growing up. Where things got destroyed or eaten because it was left out. And so, you have to keep that in mind until you figure out something about, what's their temperament, what's what do they like as far as what you think they'll do, what they won't do. And just, but making sure it's the house that doesn't have a pet is prepped for that pet. In the case of cats, if we're talking about cats, you want to make sure that you have a lot of enrichment for them, especially if they're going to be indoor cats, because cats really, for the most part, have a pretty good prey drive. And so you want to give them, places where they can kind of like cat trees and things to keep them occupied, to toys and whatnot that really kind of get the prey drive going, because that's what they're going to default to. And if they don't have that, that's why cat behavioral problems are so common. Is that we're taking an animal that's used to being kind of solitary and a hunter, and we're telling them, hey, you gotta stay inside with nothing to hunt, and
Hmm.
you got to be around people and maybe other animals, and some of them they'll go crazy because that's not what they were made for.
What do cat behavioral problems look like? I haven't had a cat since I was a kid.
Well, I mean, probably one of the biggest ones is going to be inappropriate urinating, defecating
Oh.
sometimes. A lot of times, it can be even self mutilation, like excessive grooming. Um,
Oh, wow.
can be that. But probably the most common symptom is just chronic urinary tract problems. The bladder is a stress organ for cats. So when they have a lot of stress, they have a lot of chronic urinary tract problems. So there's a lot of
Interesting.
bladder stones, a lot of recurrent urinary tract infections. Male cats can get urinary blockages quite easily compared to some other species, especially compared to dogs. Not that male dogs can't block, just that it happens much less frequently than male cats. But yeah, I'd probably say that the vast majority of chronic urinary tract issues I see probably have a root in stress, and we'll try to see if we can figure it out with the owner, kind of going through things that have maybe changed in the house, and the owner just keeps saying there's nothing changed. This cat has no stress in its life. It's like, yeah, but he's a cat, so by definition, being in a house
Mm,
and being around other things that he can't hunt is stressful. And so,
right.
there is stress whether or not, you're actually seeing it. And you're like, oh, well, no, the two cats get along. I've never seen them fight. Well, they might not be fighting, but they can do something called resource guarding, where every time one is trying to go use the litter box or go to eat, that the other one is basically stalking them, and
Hmm.
kind of like intimidating them away from that. And that can
Mm,
lead to stress. So cats are very challenging for that reason. They aren't, the saying that goes around a lot in our profession is cats aren't little dogs. It's one of those things that sounds obvious, but that's I do feel sometimes that people do just assume, well, it's just like a dog but smaller, right? They're a little bit different
right.
diet, and they're smaller, and
Right.
they like they'll go to the bathroom in the litter box, but they're basically the same. No, dogs are social. They're
Yeah.
pack animals, and cats are not, and so they are very different just in the way that they think, and that's why I have a colleague who, would jokingly say cats are aliens from another planet, and it's because they just act so different than dogs. Whereas, most dogs, you kind of know where you stand, you know what drives them. Cats, it's much much harder to figure that out.
Which is so interesting that we as a species even decided to domesticate them. You
I
know what I mean? Because
Yeah,
truly,
yeah.
like of all the animals that we could have, like we were like, yeah, let's look at this thing that clearly doesn't want to be around me all the time, and let's like
Hmm.
bring it into the house
Yeah, yeah,
and domesticate. And of course, a lot of that domestication started from farms and them being around to get rid of vermin, which
yeah.
makes complete ecological sense. But to then bring them into the house and decide to make them a pet seems a more of a stretch there than with dogs.
Yeah, no, I agree. I think that some of the most well-adjusted cats I've ever met are cats that, if not completely outdoors, like a barn cat, are ones who spend some time every day outside.
Yeah.
Um, it's because they're getting that that prey drive and everything out of them. But I think that there is a sense that, well, when they're outside, they're in danger.
Hmm.
Okay, that's fair enough. Again, if that makes them happy to be outside, then
Right.
especially when I encounter a cat that again is having a lot of behavioral problems. At some point, I try to encourage them to do lots of things in the house to try to make them feel like they're more outside. Like, again, in
Yeah.
a cat tree, they can go at the top of the cat tree and basically act like a predator.
Yeah.
They can be like looking over like they're hunting something. Even if there's nothing to hunt, they can still do that. And that satisfies, that scratches that itch, so to speak, that they
Yeah.
have. So, it's much more difficult, but at some point I start to maybe like leech in the idea that, hey, what if they went outside for a little bit? I'm not
Yeah.
saying
That's
like
interesting.
unsupervised or something. You want to leech, you can go out with them. But then I can tell you from, cats that I own myself, that cats who are not used to being outside, you let them out the first time, they end up climbing a tree and getting stuck, and you have to go rescue them. So,
So the cat that I grew up with, he was his name was Aileron. He lived to 17, and
mhm,
he literally was a a stray in Lancaster City. And my
mhm,
mom brought him into the apartment either when she was pregnant with me or like right after I was born. Apparently, he used to sleep in my crib.
mhm,
But he was inside outside his whole
mhm,
life.
Yeah.
And he would actually get in scraps. You could hear him when we moved to Washington and we lived near the woods. You could
Hmm.
hear him get into scraps with either other cats or other animals. So she would send Bear, our lab, out the back door to go fetch the cat. And Bear would disappear into the woods, swear to God,
Yeah.
and come trotting with the cat in tow, like back to the house. But he lived to be 17 and he was inside outside
Yeah.
his whole life. His whole
Yeah.
life.
And yeah, yeah, absolutely. And that's that, that I think it is probably what they like. And
Oh, I'm sure of it.
to be able to do that. And, that's one of those things that most of my cats that I've owned, they were indoor cats. And so trying to convert them to outdoor cats can be challenging. But
Mhm.
I know my wife tells the story of when she was growing up and her cats were outdoor cats. And she has some stories about that and about the one who would bring stuff home, at the
Mhm.
look what I caught you and
Mhm.
leave it at the front door.
Yeah. Yeah. Here's the little gifts that I'm giving you because you feed me and change my litter box.
Yep. Yep. Absolutely.
Absolutely. Well, I
Mhm.
definitely learned something today. Like I said, I haven't had a cat since I was a kid. Michael's allergic. Plus, he's not so
Mhm.
secretive about it. He really doesn't like cats, which
Mhm.
he wasn't allergic. I would not let that fly, but it is what it
Yeah.
is. But yeah, I didn't realize that the bladder could be tied to stress. I think that is so interesting. And hopefully, at least one person listening can kind of pick up on that and maybe make a little bit of a change for their own cat.
Yeah. Yeah,
Yeah.
absolutely. I think there's a few things, but I definitely think that stress. And again, since we're talking about fosters and bringing new pets into the home, that the
Hmm.
more that you can have around the house to kind of allow the cat to have that prey drive, whether it be like the boas that have the swishy tails to
Hmm.
because that's like a lizard tail that they can again
Hmm.
kind of chase, or again a cat tree that they can be on and just kind of looking over everything or other high places, that
Hmm.
some I've seen people into the sides of their walls. They'll put like shelves, like, that they can like hop up on and they're, just in like sleeping on like a shelf at the top of the wall in the house. You
Hmm.
can do stuff like that. That's a little bit more permanent into the structure, but certainly again, like a tall cat tree would work, or some other
Hmm.
place up high that they can get to, high shelves and whatnot that they can get up on and, again, sleep up there if they want, or just get up there and just kind of, lord over everything and keep an eye on everything and look out for prey.
Or if you don't like chores, just don't clean your house for a while and then you'll get mice and then you'll have natural prey for your cat. It's a win-win. So
Yep. Yep.
what are some small, cost-effective and immediate changes that
Mhm.
owners can make to better the lives of their pets? I think this is such a
Hmm.
great question right now because you already talked about kind of the cat side of it. Wait,
Yeah.
what would you say to some dog owners? What are some small, immediate things that could really improve their dog's well-being?
Well, I mean, one of the biggest things that I find myself advocating for that might sound simple and maybe even sound like something that everybody does every day, but sometimes when I scratch the surface, I find that when I ask about, do you take your dog for a walk? The immediate answer is usually, yeah, yeah, I take him for a walk. Okay, well, do you take them different places? No, they just go out in the yard. Okay, well, there's a couple problems with that. Going out in the yard can mean lots of different things. It could mean that they're running around the entire time they're out there, but it also could mean they run around for 5 minutes and then just lay out there the whole time.
Uh-huh.
So they're really sometimes not getting the exercise that they need just because they're out in the yard for an hour or whatever time. So taking them for a walk, but also taking them different places, because they don't just need the physical activity. That gets them mental stimulation. When your dog stops and sniffs at something, let them. So many people are like, come on, let's go. Let's get this walk
Mhm.
over with. Let him sniff. He's getting mental stimulation when they're sniffing. They can
Mhm.
detect so many things with their nose, and it's almost like they're painting a picture in their head when they're smelling. Like
Mhm.
they can smell everything that's like been by there, and if they're interested in it, it's probably means because there's something new there that they haven't smelled before, or something that they don't smell often, or something else that has their attention. Let them smell. Let them take their time and smell. That gets that brain stimulated. I think along that same way is I mentioned some of the things for cats inside, like toys that kind of stimulate the prey drive. Get some toys that make the dog think. I know that might sound kind of silly, but food puzzles or where you can hide treats in and they have to figure it out. I did have somebody tell me yesterday or today that when they got one of those for their dog, the dog just smashed it until they could get to the treats. And which case then you probably have to do a little trial and error with
Yeah.
that. But that, I think a lot of behavioral problems in dogs are because their mind is not being used properly. So I think stimulating them mentally with toys was also very important. I've also suggested more than once to owner, can you find a job for your dog to do? Like, it doesn't have to be anything that you really need done. Just make them think that, that something is the most important thing for them to do and something that they'll do really well. And that again, I think that helps behavioral, helps satisfy them or make them feel like they've done they've had a job well done and that they they get some satisfaction out of that. I find that especially with certain breeds, and that's what really kind of gave me the idea to start suggesting that to owners in general. It's like, if you want your dog to be, have a good mind and not be anxious all the time, even if, they seem like they're young. Oh yeah, they seem like they're well adjusted. That can change. They can develop anxiety later. So work on some of that stuff early and maybe get them into something. So if not, like the stimulating walks with all the scents and everything, or if you can't find a job, then get them into something like agility or scent work. Even if it doesn't have to be physical, scent work. Get them into like learning how to detect scents and try to find scents. That's stuff to occupy the brain and, really gives them a purpose. And just again, with the service dogs and working dogs that I experience, especially when you think about, one of the breeds that gets used for working dogs a lot is a German Shepherd. And I just feel like that there's a lot of German Shepherds that have anxiety and they're the ones who aren't working. And they have such a strong drive and they were bred for working. And so when they're not working, they're probably going crazy at home, just sitting around doing nothing. Like, this is not what I was meant for. I was meant for, doing something more. Give me something to guard. I don't care if nobody is ever going to break in. Give me something to guard. I'll walk the perimeter of the yard and guard it with my life. I don't care if, nobody ever comes in or, it doesn't matter if there's all other kinds of safety measures. Just give them something to do to occupy their mind. And I think in a lot of cases, they'll be a lot happier and less anxious.
I am in love with this conversation, and I'll tell you why. Because I'm going to actually give you a resource that you can certainly use or not use. There is a solo episode of this podcast called Walk It Out. And it's literally me just expressing to whoever is listening, with, the dozens of people that are listening, that what changed dramatically in my life with multiple dogs when I suddenly was separated from my husband at the time was taking them on daily walks, and how it completely changed my relationship with them. It changed how crazy they were when I got off work. It fixed so much. And we actually use that as a behavioral tool with our fosters, with any new dog we've brought into the household. We use walking as a tool. So that's a resource for you, is that if you have a patient that needs a little bit of an extra opinion on that, feel free to send them the podcast link. Yeah. What I find so interesting about the people that I'm meeting and the conversations that I'm having, sometimes it can feel like veterinarians go about animal welfare one way and trainers go about it another way. But what I'm learning is that you guys are actually advocating for a lot of the same things. You're just kind of saying it in different ways. So, like, for
Mhm.
example, if you listen to a dog behaviorist who talks about aggressive dogs, one of the very first things they do is they have them go get checked out by a vet, especially if it's a new behavior, to make sure there's not a pain indicator that
Right.
is being missed. And that's what's, getting that aggression to come out, is because that dog is protecting itself from further pain. And
Mhm.
then if you talk to a trainer about, like, talking to you about, hey, how can you better your dog? You said a whole lot of words for enrichment, which
Mhm.
every person I've had on here that's talked about behavior or talked about training has said how important enrichment is.
Yeah.
So I'm just really loving this conversation because it really brings a lot of that full circle for the way that we're trying to, like, emphasize well-being, emphasize integration of rescue dogs, and get people to understand, like, you don't have to start with a dog as a puppy, because you can start with a dog as a puppy from a quote unquote breeder, and you can
Mhm.
still screw that dog up if you're not taking some of these basic steps to make sure that this dog is its most well-adjusted self.
Yeah. Yeah, absolutely. I mean, just because you have a puppy that again maybe has all the best breeding and has like all the genetic benefits of having good behavior, they can still turn out to not have good behavior for a variety of reasons. And the same thing in the opposite direction. You can start out with coming from a bad situation that has really kind of put them behind the eight ball, but you do the right things for them and they'll still turn out to be good behavior wise. And then there are those who, no matter what you do, you can do all the right things, you can have all the right breeding, and it still turns out to not be good. And fortunately, those exist as well. It's I mean, I think like we said, like the enrichment part of it is to me one of the biggest things I try to recommend whenever we even start to see the first signs of maybe some anxiety or some behavioral issues. Or again, a lot of times, certain breeds that just are the very driven type that, are prone to anxiety and aggression. I always try to get them on the right track, whether it's socialization, which is also very important, or
Mhm.
again, the enrichment, really try to get them into something that's going to give them a purpose, because again, some of the most well-adjusted shepherds and other breeds are the ones who have jobs, the working dogs, the service dogs, or the ones where the owners do something like that with them. They do agility, or they do dock diving, or some other fly ball, or something like that that
Mhm.
gives them purpose and stimulates both their body and their mind.
I have had such a good time talking to you today. This has been so great. I've learned a ton. And I'm really grateful that you took the time out of your day to spend some time with me. I know you have a busy role in the practice, and I just really, really appreciate it. So, how can pet owners find you or find vets in their area that are like you?
I don't know that there's any one resource that will kind of cover all alternative modalities, but I have found that if you just kind of search your area, and if there's a specific treatment that you would like acupuncture or spinal adjustment, or rehab, you could type in the area you are, along with veterinary rehab or veterinary acupuncture, and you're probably going to get, because mostly everybody has a website, you're probably going to filter through and get some practices that do those. There are some websites that do have search engines where you might be able to find, if not somebody, immediately in your town, probably, somebody relatively close by, or the closest ones that you can get. I mentioned Chi University before, where I did my acupuncture classes and herb classes, and the other doctors I work with and have worked with at KVET that do acupuncture. That's where we've all taken all of our acupuncture and Chinese medicine classes. They do have a vet finder spot on their website. Their website is chi.edu, chi spelled CHI. I mentioned IVIS, the International Veterinary Acupuncture Society. They also have on their website a place where you can search, probably for those who have taken who have gotten their certification through IVIS. That is ivas.org, where you can find acupuncture. For rehab, there is an American Association of Rehab Vets. That is rehabvets.org, where they have a place that you can search for rehab vets. The adjustment technique that I use, that I mentioned before, veterinary orthopedic manipulation, their website where you can search for a practitioner of this particular form of spinal manipulation, vomtech.com is where you would find them. There is also I think it's American Veterinary Chiropractic Association. So there are veterinarians that do, and also human chiropractors that can be certified to do this on animals. That organization is, their website is animalchiropractic.org, where you can search for those who have been certified through their organization. Other than that, probably again, searching your town or your area and the specific treatment that you would like. Again, acupuncture, rehab, spinal adjusting, chiropractic, whatever term you want to use to search. And you can usually find animal hospitals that probably have that on their website.
I will link every single resource that you just cited in the show notes for this episode. That way, if someone is looking for a specific website, they can go right into the details of this episode and they can find every single one of those websites that you mentioned. I know that there are circumstances sometimes where I've heard where an animal comes in for care and the owner can't afford what that animal needs. And there are circumstances in which then there will be a conversation between the vet and the owner where the animal that will then get surrendered as opposed to euthanized, because then maybe the vet says, I don't think this animal should be euthanized. I think this animal can be treated. How does something like that happen? And then as the vet, I mean, have you dealt with that in the past? How do you deal with that animal? Do you take it into your own home? What does that even look like?
It can look a variety of ways, but the biggest one has to be that the owner has to be willing to surrender the animal. And it probably works best if there is a definite receiver of the pet on the other end, whether that be an employee or someone that the employee knows that will take it. And so therefore it's not just, well, we're just going to take it and keep it here. That doesn't always turn out so well. And depending on who you work for, that may not be endearing to them, that, now we've got an animal taking up, pet taking up one of our cages that we could use for one of our patients to, in the hospital. And, so there needs to be yes, we're going to take it in, and this employee is going to take it, or this friend is going to take it. I will tell you that just about every pet that I've had since I've been a veterinarian has been in some way, shape, or form, we'll say, a rescue, because they've all been cats, and none of them were kittens that we went and adopted. Like, this was cats that were either brought in for one reason or another, or in a couple of the cases, friends or whatever, that were moving and couldn't take the cats, or in one case, a friend who developed a severe allergy to the cats and just couldn't bear it anymore, had to give the cats up, and so we ended up taking them. But the first two I definitely got through work. One was a cat that was being spayed at my first job, and it was I believe a rescue that was spaying her, and she was one of two that was found in a house abandoned. I just kind of fell in love with her. I'll just be honest. And she was in there recovering from her surgery. She was the cutest little thing, and she was so sweet. And me and my wife had just gotten married, and we had one cat, but the one cat came from my wife's house where she was with another cat. So she got along with other cats. So he said, what if we try to bring one in? So I called my wife and said, hey, there's this really cute cat that I might be able to take home. Is that okay? And she said, absolutely. And so that's how I got my first one. So that one was really through a rescue. It wasn't a surrender, but the next one I did was a surrender. And it was a young cat who had experienced multiple urinary blockages, which mentioned before is an unfortunate problem of male cats. He was only about 2 or 3 years old, and he was owned by an older couple. And I had to have the conversation with them about that because he had blocked multiple times within the span of just 1 week. He needed to have a surgery. And if he didn't have that surgery, the chances of him surviving long term were not very good. Well, they were stretched because he had been in for 2 different times for being hospitalized that week. They were stretched to their limits. They couldn't afford to do the surgery, nor did they feel like they were going to be able to recover him after the surgery and do what needed to be done. So it's like, well, we can't leave him blocked. So our options are, if he's not going to have the surgery, then he probably needs to be put down because it's not going to be good unless he's fixed. So again, it was another situation of not just that he was a young cat who had something that we might be able to fix, but he was just like, I can say this now because he was my cat for like 15 years. He was the best cat ever. But even then I knew he was special because when cats have urinary blockages, they're in a lot of pain. And so they range anywhere from very resistant to handling and manipulation to very aggressive about it when they're blocked. And again, it's very understandable. He acted like, even though he was badly blocked, he acted like it was, hey, how you doing? Like he just allowed it and like was really sweet about it and everything. And I'm like, man, he's not even trying to do anything. Like he's a really sweet cat. So I said, you know what? Maybe we can find someone to take this cat. So why don't we see if the owners are willing to? And after thinking about it, I'm like, you know what? I think my wife knows has like a relative that might be looking for a cat. Maybe we'll just take him and do the surgery and everything, and then I'll get them all up to speed, everything after the surgery, and then we'll shift them over to my wife's cousins, and so that's what happened. They agreed to sign him over. I ended up taking him, and then the first day I brought him home, I'll never forget this. He's in his carrier. He's got the cone of shame on, and I opened the cat carrier door to let him out, and he just backed out of the carrier and just like looked up at me, and I'm like, yeah, you're not going anywhere. You're staying here. Like that's all it took. And I was like, nope, you're staying.
Yeah.
This is
that's awesome. I love a good rescue story. That is great. Thank you so much for your time. I really, really appreciate it. And thank you for all the care that you've provided for all the animals that you've cared for, but especially for my Snowball, who I'm so grateful to have still moving around and sleeping on the floor next to me as we speak. He's under the desk just hiding from Cheese and the foster dog. So, but thank you again. I really appreciate it. And hopefully we can talk again soon.
Yeah, absolutely. And this was this was a lot of fun. So thank you for having me on, and give Snowball a pat on the head for me.
Will do. All right. Take care.
All right. You too.
All right. Bye-bye. On today's Foster Spotlight, I'm going to talk about a dog with Cross Your Paws Rescue named Carlos. This handsome 2-year-old boy was stuck in the shelter for 9 long months. He is bursting with personality and joy since he's been with his fosters. He's the kind of dog who will keep you laughing, smiling, and he loves to run and play fetch and explore. While he has plenty of pep in his step, he's also a sweet and affectionate boy. He adores being around people and will happily soak up all the attention, love, and belly rubs he can get. He thrives on companionship and would do best in a home where he can be a part of the family's daily life. He's eager to learn and will benefit from continued training to help him shine as the amazing companion he's meant to be. With patience and consistency, he'll quickly pick up on routines and good manners. If you've been searching for a playful, adventurous, and affectionate companion, this boy could be the perfect addition to your life. He's ready to share his heart and his love with his forever family. So Carlos is 2 years old. He is a neutered male, and he's listed as large. He looks like he might be between like 50 and 60 pounds, though it is really difficult to tell from the pictures alone. He may be a little bigger than that, so it would be important to just understand that he might be on a little bit of the bigger side, and you would want to meet him in person to make sure he suited your household. He is up to date with his vaccinations. He's good with kids, other dogs, cats. He is house trained. It doesn't say anything about whether or not he's crate trained, though he's been in the shelter for 9 months, so he probably would be okay to crate train. And if you are interested in taking a look at Carlos' profile, you can click on the links in the show notes, or you can check out at crossyourpaws.com. Thank you so much for listening. Thank you to Dr. H for his advice, and everybody have a wonderful day.